While preparing a patient for a pulmonary function test, the medical assistant notices the patient recently used an inhaler. What is the most appropriate next step? A. Continue with the test as planned. B. Reschedule the test to another day. C. Wait 20 minutes, then proceed. D. Document and inform the physician. Answer: D. Inhaler use can affect PFT results. The physician must be informed to decide whether to proceed or reschedule. Which of the following electrolyte panels would be most affected by hemolysis during venipuncture? A. Chloride. B. Potassium. C. Sodium. D. Bicarbonate. Answer: B. Hemolysis releases intracellular potassium, leading to falsely elevated potassium levels in test results. A provider asks a medical assistant to fax patient records to a specialist. What must be verified before sending the fax? A. The patient's full address. B. The medical assistant's credential. C. A signed patient authorization. D. The provider's DA number. Answer: C. Transmitting records requires HIPAA-compliant patient authorization to release protected health information. During triage, a patient reports chest pain that radiates to the jaw and left arm. What should the medical assistant do first? A. Take a full patient history. B. Perform an EKG. C. Notify the physician immediately. D. Check blood pressure. Answer: C. Radiating chest pain may indicate a myocardial infarction and is a medical emergency requiring immediate attention. Which of the following procedures requires the use of a high-level disinfectant rather than sterilization? A. Vaginal speculum. B. Rectal thermometer. C. Surgical scalpel. D. Needle driver. Answer: B. Items like rectal thermometers are semi-critical and require high-level disinfection, not full sterilization. The appropriate angle of needle insertion for an intradermal injection is A. 15 degrees. B. 30 degrees. C. 45 degrees. D. 90 degrees. Answer: A. Intradermal injections are administered at a shallow 15-degree angle just under the skin. Which document establishes the legal responsibilities of a medical assistant in a specific practice setting? A. Code of Ethics. B. Chain of Custody. C. Scope of Practice. D. OSHA Manual. Answer: C. The scope of practice defines the tasks and procedures a medical assistant is legally allowed to perform. Which of the following is the most appropriate action when a sterile field is accidentally contaminated? A. Ignore it if only minor. B. Continue but avoid the area. C. Notify the physician and proceed. D. Discard and re-prepare the field. Answer: D. Sterile technique requires the field to be re-prepared entirely to prevent infection. When obtaining a patient's history, which of the following questions demonstrates the use of an open-ended format? A. Are you feeling pain now? B. What brings you in today? C. Did you take your medication? D. Is your headache better? Answer: B. Open-ended questions invite elaboration, which is crucial for accurate history-taking. Which form must be signed prior to performing a minor surgical procedure in the outpatient clinic? A. Consent to treat form. B. Advance directive. C. Informed consent. D. HIPAA authorization. Answer: C. Informed consent ensures the patient understands the risks, benefits, and alternatives of the procedure. If a patient is suspected of insurance fraud, what is the medical assistant's ethical responsibility? A. Contact law enforcement. B. Confront the patient directly. C. Report the concern to the provider. D. Deny service until resolved. Answer: C. MA must inform the provider or compliance officer, not act independently. Which hormone is measured to confirm pregnancy? A. FSH. B. HCG. C. LH. D. TSH. Answer: B. Human chorionic gonadotropin, HCG, is the hormone detected in pregnancy tests. AMA receives a critical lab value for a patient. What is the most appropriate immediate action? A. File the result in the chart. B. Leave a voicemail for the patient. C. Inform the physician urgently. D. Repeat the test for confirmation. Answer: C. Critical lab results must be reported directly to the provider for timely clinical decisions. In a SOAP note, where would a MA document the patient stating, "I've had this cough for 3 weeks"? A. S. B. O. C. A. D. P. Answer: A. S stands for subjective, which includes patient-reported symptoms. Which of the following is a CLIA-waived test commonly performed in a physician's office? A. Complete blood count. B. Fasting glucose. C. Lipid panel. D. Liver function test. Answer: B. Fasting glucose can be performed using CLIA-waived equipment in office. When collecting a throat culture, which of the following should be avoided? A. Touching the tonsillar area. B. Using a sterile swab. C. Swabbing the posterior pharynx. D. Touching the tongue or cheeks. Answer: D. Touching non-target areas can contaminate the sample and lead to false results. Which of the following laboratory departments analyzes urine sediment? A. Hematology. B. Microbiology. C. Cytology. D. Urinalysis. Answer: D. The urinalysis department performs microscopic examination of urine sediment. A patient begins to faint during venipuncture. What is the medical assistant's first action? A. Call for help. B. Remove the needle. C. Elevate patient's feet. D. Start CPR. Answer: B. Safety first, remove the needle to avoid injury, then proceed with first aid. What is the primary purpose of OSHA in a healthcare setting? A. Protect patient privacy. B. Prevent disease spread. C. Enforce workplace safety standards. D. Regulate medical billing practices. Answer: C. OSHA ensures safe working conditions for employees through regulations and inspections. Which condition is a contraindication for a standard BP cuff on the left arm? A. Previous mastectomy. B. Low blood pressure. C. Elevated heart rate. D. Orthostatic hypotension. Answer: A. Using a BP cuff on the side of a mastectomy can cause lymphedema and must be avoided. Which of the following indicates that a patient's fasting blood glucose should be confirmed with an A1C test? A. 70 mg per deciliter. B. 110 mg per deciliter. C. 126 mg per deciliter. D. 98 mg per deciliter. Answer: C. A fasting blood glucose of 126 mg per deciliter or higher is a diagnostic threshold for diabetes, confirmed with an A1C. When preparing an intramuscular injection for a patient with a BMI of 42, which needle length is most appropriate? A. 1 inch. B. 5/8 inch. C. 1.5 inches. D. 2 inches. Answer: D. Obese patients may require a 2-inch needle to ensure medication is delivered intramuscularly. A patient with a positive MAN2 test but no symptoms is most likely exhibiting A. Active TB. B. Latent TB. C. False positive. D. Autoimmune reaction. Answer: B. A positive result without symptoms typically indicates latent tuberculosis infection. Which part of the SOAP note includes the provider's diagnosis and treatment plan? A. Subjective. B. Objective. C. Assessment. D. Plan. Answer: D. The plan section outlines treatment, follow-up, or referrals based on assessment. Which federal act requires identity verification for all employees, including U.S. citizens and non-citizens? A. OSHA. B. HIPAA. C. FLSA. D. IRCA. Answer: D. The Immigration Reform and Control Act, IRCA, mandates Form I-9 to verify identity and employment eligibility. Which of the following body systems primarily regulates pH balance through CO2 removal? A. Urinary. B. Endocrine. C. Respiratory. D. Lymphatic. Answer: C. The respiratory system helps maintain pH by regulating carbon dioxide levels. Which term refers to the surgical removal of part of the colon? A. Colostomy. B. Colectomy. C. Colonoscopy. D. Laparotomy. Answer: B. Colectomy is the partial or complete surgical removal of the colon. A medical assistant observes erratic waveforms on an ECG. What is the first step? A. Repeat the ECG immediately. B. Notify the provider. C. Check patient's skin preparation and lead connection. D. Switch machine settings. Answer: C. Improper lead placement or poor skin contact is a common cause of artifact. Which of the following procedures requires sterile gloves? A. Venipuncture. B. Pap smear. C. Suture removal. D. Wound dressing change with exposed muscle. Answer: D. Exposed tissue or deep wounds require a sterile field and sterile gloves. Which scheduling method is best for minimizing patient wait times in high-volume practices? A. Stream scheduling. B. Wave scheduling. C. Cluster scheduling. D. Modified wave scheduling. Answer: D. Modified wave scheduling balances efficiency and flexibility in busy settings. Which lab test would be most appropriate to monitor a patient on warfarin therapy? A. Hemoglobin A1C. B. Prothrombin time, PT/INR. C. Basic metabolic panel. D. Hematocrit. Answer: B. PT/INR is essential for monitoring warfarin's anticoagulant effects. Which of the following is a contraindication for administering a live vaccine? A. Type 1 diabetes. B. Pregnancy. C. Hypertension. D. Recent antibiotic use. Answer: B. Live vaccines are generally contraindicated during pregnancy due to risk to fetus. What is the first step in responding to a needle stick injury? A. Report the incident. B. Clean the area with alcohol. C. Squeeze out the blood. D. Wash with soap and water. Answer D. Immediate washing reduces risk of infection and is the correct first response. In ICD-10-CM, the placeholder character X is used when A. There is no code match. B. To indicate a future diagnosis. C. As a space filler for code structure. D. For unspecified diagnoses. Answer C. X is used to preserve code structure when a character position is not applicable. Which of the following instruments is required during suturing? A. Tuning fork. B. Hemostat. C. Otoscope. D. Reflex hammer. Answer B. Hemostats are used to clamp tissues or vessels during suturing. Informed consent must include all of the following except A. Patient's literacy level. B. Risks and benefits. C. Alternative treatments. D. Nature of procedure. Answer A. Literacy is important but not a required element of informed consent documentation. Which endocrine gland secretes a hormone to lower blood calcium levels? A. Pituitary. B. Adrenal. C. Thyroid. D. Parathyroid. Answer C. The thyroid gland releases calcitonin, which decreases blood calcium. Which part of the nervous system is responsible for involuntary functions like heartbeat and digestion? A. Somatic. B. Autonomic. C. Central. D. Peripheral. Answer B. The autonomic nervous system controls involuntary bodily processes. Which type of consent is demonstrated when a patient rolls up their sleeve for a vaccine? A. Written. B. Implied. C. Verbal. D. Informed. Answer B. Implied consent is assumed by a patient's physical action or behavior. Which law prohibits the use of genetic information for health insurance underwriting? A. HIPAA. B. FMLA. C. ADA. D. GINA. Answer D. The Genetic Information Non-Discrimination Act protects against misuse of genetic data. A patient's pulse is 48 BPM, regular rhythm. What is the term? A. Tachycardia. B. Bradycardia. C. Arrhythmia. D. Normal. Answer B. Bradycardia refers to a heart rate below 60 BPM. What is the correct medical term for difficulty swallowing? A. Dyspnea. B. Dysphagia. C. Dysuria. D. Dystonia. Answer B. Dysphagia is the medical term for trouble swallowing. A patient refuses care. The MA should first A. Call the provider. B. Document refusal in the chart. C. Educate about risks. D. Have the patient sign a refusal form. Answer C. Education should be provided before documenting or escalating refusal. Which insurance claim form is used for billing professional services? A. CMS 1500. B. UB 04. C. HCFA 500. D. CPT 99000. Answer A. CMS 1500 is used to bill for outpatient and professional services. Which action is a breach of patient confidentiality? A. Discussing patient info with billing staff. B. Texting a patient's lab result to another provider without consent. C. Sharing patient chart with the attending physician. D. Faxing to a hospital with release form. Answer B. Transmitting protected health information without consent violates HIPAA. Which part of the brain is primarily responsible for balance and coordination? A. Cerebrum. B. Hypothalamus. C. Cerebellum. D. Medulla. Answer C. The cerebellum controls motor coordination and balance. A prescription reads Sig. 1 tab POTID/PRN pain. How often may the patient take the medication? A. Once a day. B. Every 8 hours if needed. C. Only before meals. D. Every 12 hours. Answer B. TID/PRN pain means 3 times daily as needed for pain. Which of the following is a systemic sign of infection? A. Redness at injection site. B. Purulent drainage. C. Fever. D. Swelling. Answer C. Fever indicates a systemic immune response to infection. In which circumstance can a minor legally consent for care without a parent? A. Dental cleaning. B. Vaccination. C. Pregnancy treatment. D. Vision screening. Answer C. Minors may consent to treatment related to pregnancy in many states. What is the primary function of thrombocytes? A. Oxygen transport. B. Antibody production. C. Blood clotting. D. Nutrient delivery. Answer C. Thrombocytes, platelets, help in hemostasis and clot formation.